Welcome everyone. Today we'll discuss chapter 4, therapeutic communication and nurse patient relationship. In that we'll see therapeutic communication, types, techniques, characteristics and barrier. So, what is communication? Communication, it is the exchange of ideas, thoughts, information from one person to another. That is communication. How this communication takes place? Like process of communication. The sender will be there. He will send messages to the receiver. The receiver, he will receive the message. Then he will give response, and that response is known as feedback. This is how communication take place. Next is therapeutic communication. This therapeutic communication is there, no? It is the interpersonal interaction which will occur between the nurse and the patient, during which nurse will focus on the specific needs of the patient to promote effective exchange of information. That communication which occurs for the therapeutic purposes is there, no? That is therapeutic communication. Next is types of communication. There are two types of communication. First one is verbal communication and second one is non-verbal communication. The verbal communication is there. It occurs through words spoken or written. Written by writing it occurs, then it is verbal communication. And non-verbal communication is there, no? It occurs through gestures, physical appearances, postures, touch, facial expressions. And in non-verbal communication, it does not involve spoken words or written words. Next is techniques of therapeutic communication. First is listening. Listening means if the nurse is there, no, she should properly listen to what the patient is saying, and she should note everything what the patient is saying about himself or the issues or problem he is suffering. Next is broad opening. Here encouraging the patient to select the topic for the discussion. Any topic will be there for the discussion which we have to discuss which is very important for therapeutic communication, that we have to discuss. Then next is resetting. Resetting means repeating the things. If there is any confusion or anything the patient is saying, and if you want to clarify anything, then you have to repeat the thing and you have to clarify it. Next is clarification. If any doubt is there, you have to again ask the patient and you have to clarify everything. Then next is reflection. We have to think deeply about something, like anything is there, like thoughts, ideas, feelings, anything will be there, no? You have to think deeply about that thing. Next is humor. It is ability to make others laugh. If anything is there, like if anything you want to say, but if you say that thing in a jokingly manner, or if you say that thing like in the funny way, then you will also get your answer also, and it will also not hurt any patient also. This is humor. Informing means if any informing, like you have to inform about, like if any medication is given to the patient, then you have to inform him like when to take these medications, then how to take that medications, then what practices he have to do, like physical exercise or meditation he have to do, or when he have to visit the hospital. Everything, each and everything about the details you have to inform. Okay. Next is focusing. Mostly you have to focus on the things which you want to know. Like if any condition is there and you want to know about that condition, then you have to focus on that problem only, and you have to ask him about that topic only. Like you have to give more importance to that topic only. Next is sharing perception. Sharing perception means asking the patient to verify the nurse's understanding of what patient is thinking or feeling. We have to ask the patient like how he is feeling. Like maybe he is responding normally, but his expression is like he is angry with you. You have to ask him like, are you comfortable or are you okay with us, and all we have to ask. Next is theme identification. This involves identification of underlying issues or problem experienced by the patient. So we have to identify any issues which is there with the patient, or any problem he is suffering, means we have to identify. That we will call theme identification. So silence, you all know, no, silence means lack of verbal communication for a therapeutic reason. So like for example I will give, like sitting with the patient and non-verbally communicating interest and enrollment. Like non-verbally, you are sitting and you are communicating with the patient non-verbally, you are communicating, that is silence. Next is suggesting. So like if any, he said you about any problems, and you have to now suggest him about the ideas to the patients, like to, if there is any problem, then you can solve it by giving or suggesting any ideas to the patient. So that is suggesting. So next we'll see barriers of therapeutic communication. So mainly there are three barriers, that is physical barriers, psychological barriers, and environmental barriers. So these physical barriers are there, no, it affect the person like physically. Like if there is any hearing defect, then you will not be able to properly communicate because you can't even hear, right? Then speech deficit is there. Like if you can't speak properly, then you can't be able to communicate with others. If there is any eye problem, then you can't even see. If non-verbal communication is there, you know, it involves gestures, postures, and by seeing expression the communication will take place. If eye problems is there, then how you will communicate? Through the eyes. You will not able to read someone's facial expressions, right? Next is psychological barrier. So psychological barriers means like psychological factors will be there, they will act as a barrier in this communications. Like anxiety will be there, like how I will talk to this person, oh my god, like I'm getting like feeling scared, oh I can't, like social this will be there, no, fear will be there, like that. Psychological barriers. Then psychological upset, if someone is upset, then he will not speak, right? Then if there is no willingness to communicate, like if we don't want to communicate only, then how you will communicate with someone? So these are some barriers which will affect communication. Next is environmental barriers. So environmental barriers are also there, like if there is extreme heat or cold, like if there is too much of heat, then how you will communicate? You will feel very hot and you can't communicate, right? In the same way, if it is cold environment, means you even can't communicate in that environment also. Like if there is also noise outside, then you can't communicate. Like you are sitting and you're communicating and there is the whole loud noise outside, like all the vehicles are running by there and they are horning the vehicles. That time also you can't listen, right, properly. You can't concentrate on what you are telling, what you're speaking. So this is kind of a barrier. Next is poor ventilation. So you are sitting and you're talking, and if there is not proper oxygen supply, if there is not adequate lighting and all, then you can't communicate. Like if there is no proper lighting, you can't see the patient's facial expressions. And if you are if air is not there, then you can't you can't speak properly, you can't be able to take breath. So these are some environmental factors by which these are environmental factors which will affect the therapeutic communications.